Okay, now we see a patient, they're laying on their back, they appear to be unresponsive. My gloves are on, my CPR shield is available. I have the AED with me, there's nothing around the patient that would be a contraindication for using an AED, like a combustible liquid, flammable gases, standing water, or any other reason why we would not use an AED on this patient. From this point on, we're going to now begin with an assessment of the patient, just like we would in a real scenario. Patient, are you okay? There's no response. You in the green shirt, go call 911 and come right back, or call the code. Look, listen, and feel for breathing with a head tilt, chin lift. There's no breathing. I'm going to give 2 breaths. The breaths went in, we saw chest rise and fall. This wasn't a witnessed arrest. I saw them go down, and I'm checking for a pulse for no more than 10 seconds after my 2 breaths. The patient does not have a carotid pulse. I'm going to go ahead and turn on my AED and start the AED protocol.
Remove clothing from person's chest.
If there's any wetness on the chest or nitro gel patch, we're going to wipe that off.
Attach pads firmly to person's chest, as shown.
We're going to go ahead and attach these pads as it shows you a diagram on the pads, the proper locations, above the right breast,
connector.
Below the left breast, mid-axillary.
Check connector and pads.
We're now going to plug in the
Analyzing
pads.
rhythm. Everyone stand clear.
Do not touch the patient while we're analyzing.
Shock advised. Charging. Everyone stand clear.
Another check to make sure no one's touching the patient.
Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
Center of the chest between the nipples. 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We're going to do this for approximately 2 minutes. When the 2 minutes are up, the AEDs are now programmed to interrupt the rescuer.
1 minute and 30 seconds of CPR remain.
It's then we're going to stop, allow the AED to assess the patient, and then if it charges, we're going to discharge the AED, and then follow the promptings again until advanced life support begins their treatment. We never take off the AED as the first responder or the first layperson rescuer. We're going to let advanced life support do that if and when they decide to. In many cases, EMS actually leaves them on because it's doing the job, and it buys time for the ALS providers to be able to set up their advanced life support equipment while the AED is doing the monitoring and the shocking for them. This is a really life-saving skill. It's going to be important to get down. It's very simple to actually utilize an AED, and it makes about an 86% survival rate difference when it's applied in 6 minutes or less with CPR right away.